be showcasing cannabis care. We have our friends here from the Philadelphia Sidney Kimmel Cancer Center at Jefferson Health, and they're going to be discussing the risk and the benefits of cannabis use and managing cancer treatment symptoms. And topics will include the effects of cannabis on our body, as well as using it among cancer patients and survivors, and really how to access guidance, how to get that plan.
Yep.
I think a little housekeeping, Erin.
It's always a good idea. So we will be kicking off after our little reminders with the presentation. And as always, feel free to put your questions in the chat. We want to make sure that we're muted. So if you need any assistance with that, let us know. But you're welcome to raise your hand. And again, utilize that chat for questions. Our speakers will be monitoring that, as will Sue and I. And of course, just like everything, this will be recorded. So if you have to hop off early, or if you want to come back and sort of re-listen or share this with someone else, it will be in her library as early as tomorrow.
Perfect.
And I will share, we have one more event. I'm so excited. So we're bringing in our Ask the Experts at the end of the month. So May 30th at 1 p.m. Eastern time, we have one of our providers, Dr. Tashina Reeder. She's one of our mental health providers. She will be joining me to answer questions and talk about PTSD trauma, strategies for overcoming the emotional and psychological roadblocks that often our members share that they're experiencing. She'll be touching on the trauma related to disease recurrence or risk of recurrence and so much more. So we're really happy to be highlighting her as a provider and have her answer questions and discussion around this really important topic that we know comes up so often in our community.
Yeah, and that is on May the 30th, 1 o'clock in the afternoon. And you'll see here in the chat, you can submit your questions all the way up until then. And then Erin will actually keep track of them and have them ready to go.
Absolutely. And let me share my screen, Sue, for you.
Yeah, we always like to thank our sponsors. You know, we can't do what we do without them. We get a lot of support from our leading sponsors, West, Merck, and Daiichi Sankyo. And then we have some additional support coming from Lilly, GSK, EO, our newest sponsors who are here with us tonight, and Gilead Sciences. So it is really important for us to put them front and center and thank them, because we do 36 of these a year, and we cannot do what we do without their support. So we are most grateful. You can also find all of our speaker series, Ask the Experts, virtual hangouts, all in our library. So I'm going to pop that in the chat as well. And you can just go back and peruse some of the topics. That library is incredible, Erin. We have so many meaningful topics that are still good to this day, even though we've done them a couple years ago. We did a nice little intake of our library to make sure everything was up to date. And
Yep.
I'm so impressed with all of the different topics and the speakers that we've been able to get, and just really becomes a valuable resource.
I know. And I love that there's also a search function. I know that I've been using that a lot as I'm connecting with our members, and I say, oh, we didn't ask the experts on this. Let me share that link with you. So now I can easily search and I can find that episode from last fall or last spring. So know that if there's something that you want to know if we've discussed, and have some relevant information and some expert speakers, search through our library, because it's probably there. But if not, let us know, because we're always looking for topics. And Sue and I, just this afternoon, we're planning our second half of the year. So we've got great things coming.
Yeah. And then before we get started, just tell us where you're coming in from. You know, we're nationwide now, so we love it we love to see where everybody is phoning in from, Zooming in from, and joining us this evening. So pop them in the chat, and that will be really fun for us to take an inventory. Got Idaho, New Jersey, of course,
I love that.
Philadelphia area. Yeah, Florida, New York, PA, West Virginia.
Los Angeles. Love that.
It's just there. Yeah.
Mm-hmm.
All right, Erin, I think we are ready to go. What do you think?
I love it. Let's jump right in.
All right, we're going to bring our two guests front and center. Erin, I'll let you do that while I do the intro. So today we have Dr. Brooke Worcester, is the director of the Division of Supportive Oncology and medical director of the Cannabis Medicine for the Science and Business Master's Program at Jefferson Health. And we have Greg Garber, who is the director of Oncology Support Services at the Sidney Kimmel Cancer Center. Jefferson has been a longtime partner of Unite for Her, as many of you will know. Well over 10 years, and we are just so grateful to bring this part of cancer care treatment front and center. So I am going to let you both take it away.
Thank you so much, Susan, and thank you guys for having us here tonight. Very, very happy to answer all of your questions. Would very much love to make this kind of interactive and be able to give you the information that is helpful for you. By way of background, just so you know where we're coming from, aside from Philadelphia, I am a internist by training, and then did fellowships up in Boston. If anyone here is up in Boston, at Dana-Farber and Mass General in pain management and palliative medicine, because I was really interested in cancer pain management specifically. And that kind of brought me really to the space of kind of cannabinoid research and cannabinoid based care, because patients and their caregivers asked me about it all the time. And we truly did not learn a lot in medical school about it. So a lot of your physicians are trying to really catch up and feel comfortable even in the space talking to you about this stuff. So nice to meet everybody and nice to be here.
Great, thank you so much for having us. I'm Greg. I'm a social worker, and I work with Dr. Worcester at Jefferson in our division of supportive oncology. And about 5 years ago, when it could be a little longer, when Pennsylvania started its program, its medical marijuana program, we decided that we wanted to help our patients access this and become educated and get support around using medical cannabis. We know that a fairly high percentage of people going through cancer care and in survivorship use cannabis in one form or another, and it largely exists in kind of the Wild West. Some people go to dispensaries, some people get from the neighbor, somebody's cousin makes gummies. So there's certainly a lot of room to put some structure around this to get it to feel and look a little bit more like the rest of care that is often very thoughtfully delivered within oncology. We've certified about 4,700 patients to date, and have had the opportunity to have lots of conversations and do a lot of listening as we kind of build our clinical program and our research program. So thanks so much for having us here.
All right, let's get started. So I think this is funny, and I'm glad that everybody got to check in and say where they are, because I would hazard a guess to say that there is literally no other part of your cancer care that is in any way really dependent on what state you live in. It's not like chemotherapy guidelines or immunotherapy guidelines change across state lines. However, kind of the way that you can have conversations or access or not access cannabis is obviously very dependent. You can see that patchwork green map there on the left-hand side sort of shows us where we are, and it's all over the board. I mean, there are some of you guys that are kind of not able to easily access this from a kind of state regulated dispensary that has products that have been kind of quality tested. And then there are some of you that can access it, with a recreational dispensary that's like around the corner. And the way that they all look and feel are very, very different. Greg, please kind of give the details about it. I struggle a little bit with the line in the sand of kind of how we call it adult use recreational versus medical. And I think it has nothing to do actually with how people are using it. I think it has to do with sort of more how your state legislature allows you to access it and what taxes you have to pay.
Yeah, it's random. If you look at the states that are medical and the guidelines and the requirements for getting certified in those states, it feels like a hodgepodge of random things that a legislator in one state may have a relative who had this condition, so that gets on the list. And pain is always on the list, but there's really very little science to it, unfortunately. But it is certainly a start. And so as programs evolve and as we hopefully make some progress on the federal level, this map may look a little bit more consistent. I say may very cautiously. Taxes on cannabis, just very quickly, for recreational states can range from 5–10% up to in the 30%. So the argument for having a medical card where there are states with recreational or adult use cannabis and medical cannabis is cost savings. That's really the main difference.
So why are we talking about this kind of as a therapeutic is really because in your body, there is this sort of system of receptors called the endocannabinoid system. And the way that the components of the plant interact with this is sort of very similar to substances your own body produces. So what's this hodgepodge of cannabis, marijuana, hemp is also confusing. And that is kind of delineated more by the federal government than, it necessarily being a different substance. So cannabis is like the scientific genus and species name of the plant, right? So cannabis indica, cannabis sativa, cannabis ruderalis. Marijuana is a term that is defined by our federal government, and it has to do with the amount of delta 9 specific, but THC, which is the part that makes you high, in the plant, right? And they draw a line and say, if you have more than 0.3%, we're going to call it marijuana. And if you have less, we're going to call it hemp. They're the same plants. It's just a different composition of what's in it. And both of them have CBD, which is not the part that kind of gets you high, but has some anti-inflammatory and other properties within that, what we call phytocannabinoid, or that chemical structure in your body. And so this is the gold to this. And this is why, everybody is interested and paying attention, right? The DEA just came out and said that they support rescheduling. And so nationally, we are going to see changes in this kind of becoming a Schedule III drug, which means we'll be able to research it in a much more quality way. And there'll be other changes down the pike. But this system of receptors, which is widely spread throughout your body, both in your brain, which makes sense because that's why the THC part crosses and makes you high, also does a lot of other things that are medically helpful in terms of anti-nausea or appetite. That's the part that, is stimulated and can be helpful through those receptors. The CB2 receptors are mostly in different areas of your body. And actually what they do that is kind of most medically interesting has to do with inflammation, right? So kind of various etiologies that cause inflammation, aches and pains, other things certainly related to the cancer and cancer treatments too. And we'll talk a little bit about that more. The other thing that CB2 receptors have a lot to do with is gut function. And so any of you that may have kind of other GI issues, or people in your family that struggle with inflammatory bowel disease or others, there are some kind of interesting potential uses there because they have a lot of receptors that are highly located in your gut. So let's talk about cancer. So Greg, do you want to talk a little bit through the demographics and stuff here?
Sure, of course. So, depending on the numbers that you look at, a decent estimate is about 40% of patients undergoing cancer treatment are using cannabis at any given time, which is a really huge percentage. And it's an interesting thing. It's an interesting challenge because you come in and you're on any other kind of medicine, and it very neatly fits into a medical record and their categories and drug names and dosages and strengths. And our electronic medical record has like cannabis, just cannabis, not strength, not route of administration, nothing else. And so we're working in a bit of two different worlds right now in terms of how we integrate this into care. Next slide.
So here's what we know. And I'm gonna start this conversation by saying, because of the fact that cannabis has for a very long time now been looked at as a federally illegal substance, research has been complicated at best, incredibly limited and non-existent at worst, right? So even the body of research that we have out there, it's something. It's not nothing. And we can certainly start to see some signals that cannabis can be effective, but we have a long way to go. When we compare this to what we know about your, ER/PR positive breast cancer treatment that has had kind of umpteen very large scale, very well done trials to look at kind of very nuanced differences in treatment. Cannabis, sometimes it's just like, are you taking it or are you not, right? And so that's kind of very far from the specificity that we want to be able to give you guys. However, what we know is that kind of the use and the market has outpaced what medical professionals and patients are having as conversations. So it happens in a silo. And that's the part that, for me, for a very long time, felt scary. That all of these cancer patients were using cannabis and everybody felt uncomfortable talking about it. And that never feels good, right? It's a little bit like, having any kind of elephant in the room that is there and you don't want to say. And so how can we help reduce risks, knowing that this is out there, and give people guidance? Because there are incredibly potent products, and we know that very high concentration of THC can cause significant side effects, concerns, physiologic issues, as well as kind of mental, emotional health kind of complications. The other thing that we know is that it is, by and large, not going to cause any poisoning or overdose. You can see that graph there. The blue line are the prescription opioids that I also prescribe every day to cancer patients, which are incredibly helpful in some instances for some people at certain times. Cannabis is the pink line that's on the very bottom, right? It has a very high ceiling in terms of tolerant, like safety, and organ, it's not going to mess up your kidneys or your liver. It's not going to cause you to stop breathing. However, that's a huge blank space of, right, you're not going to die, but let's do better and give you guidance and talk about it.
Right. And so one of the things that has become very, very evident and has been shown in our research and others is kind of where people are getting their information about cannabis. And so if you look at this graph on the right, it becomes very apparent that the medical profession is less than 10% of this. So it's either a dispensary worker who are kind of retail employees, and they can often be very lovely human beings but in terms of giving medical advice to somebody who's trying to manage symptoms of a treatment or disease, it's probably not where you want to be getting medical advice. Almost 40% get advice from no one. There are many kind of certifying doctors out there and others who are simply certifying patients, not really kind of providing any longitudinal support like one is used to getting when they're going through cancer care. And, while oncologists in our experience have been very kind of receptive to and fine with patients using cannabis, they don't know anything about it. And so, there's this bind where there's this thing that they're okay with and they know they're using, but really they are not provided with, they're not learning this in any of their training unless they're really seeking this out. The other thing is cannabis is super, sorry, go.
No, please go.
Yeah, cannabis can be really expensive. And so having to go it on your own where you're doing a trial and error process at $30, $40, $50 a product is, it's a high cost trial and error.
Yeah. And just another cost piled on to you know, the already kind of high cost of cancer care. I was going to say, to the credit of ASCO, the American Society of Clinical Oncology, they recently came out with a very well done sort of revised set of guidelines in terms of cannabis and cancer, you know, cannabis use in cancer patients and survivors. And basically they said, like, we need more research and more data about this. However, what we fully support and want to give all of your clinicians kind of, you know, at least some structure around is how to have open and non-judgmental conversations about cannabis because people want to know and are using it. And there is a very long-standing sort of socio-political stigma around cannabis that impacts sort of racial minorities, ethnic minorities, people from different financial backgrounds, different ages, very differently. And so for everyone to sort of at least say, let's start having these conversations, that's really helpful. Go ahead. Okay.
We did have one question, if I can jump in real quick. Actually now two. So what amount constitutes high dosage of THC is one. So Dr. Worcester, if you want to do that one.
Absolutely. Great question. And here's the complexity of that, is that it depends on what form we're talking about. So if you're talking about something that you're inhaling, the concentration or the amount of THC is going to be listed as a percentage. And just to like kind of set the stage here, you know, back when, you know, in the 60s, 70s, when people were kind of, you know, growing pot in their basement or their backyard or in their dorm room, whatever, the amount of, or the percent of THC that was in products was 16, 17%. Now you can buy concentrated vapes that get up to 89, 90% THC. So we tell everybody, if you're talking about a percentage or something that's inhaled, you really need to be thinking about THC under 30%. Oral products are going to be listed as milligrams, and a safe amount of THC for someone that is not a regular cannabis user to start at is somewhere around 2.5 to 5 milligrams of THC. And I tell people, like, really, if you're kind of taking this in the day for appetite, for pain, for nausea, 2.5 milligrams is a very safe dose that you're not going to feel loopy or high or dizzy. Okay. And so that's a little bit of kind of where the safe space of that is. And that doesn't mean people can't get up to higher doses, but when you're talking about where to start, that's a good anchoring point.
Great, thank you. And then there was one more. It was, is there a known interaction between THC and a gummy and tamoxifen?
Very, very good question. I think we have a specific slide where we're going to talk about that and what we know about immunotherapy too. So I promise we will get to that. Here's what we know, okay, guys, what we know, and all of this is coming from evidence that is not very real world anchored, meaning the studies that we have for a very long time looked at only Marinol, which is a synthetic THC, which is a prescription product. So it's very far from the space of kind of what we call whole plant cannabinoids, or the products that most people are getting and using. But we know that the evidence supports that cannabis can be helpful for people in the space of chemotherapy-induced nausea and vomiting, improves control of pain, and specifically cancer-related pain or neuropathic pain. And there is a subset of people that say cannabis is as helpful for me as opioids or more helpful, right? It's a little bit of a genetic difference, just like how you respond to a certain antidepressant or you know, your tumor responds to a certain chemotherapy. You are genetically predisposed to have kind of differential responses to cannabis. So some people are going to get very significant pain relief, and others are going to say, you know, it's more moderate. It's more along the lines of a Tylenol with codeine or a tramadol, something like that. But we have evidence that shows that it is helpful. The appetite stimulation has long been an association, right? People talk about munchies with cannabis all the time. You know, it's not going to change all appetite issues that are tossed at you from radiation and chemotherapy and everything, but it is, frankly, compared to anything that we even have to prescribe, probably one of the most effective tools that we have, and what evidence supports that. Anxiety, it's tricky. I think what we see is really that CBD is the helpful thing, and that THC, in higher doses can actually worsen anxiety, but in lower doses, certainly can be helpful. And actually, I just got a message that I don't think we have the slide that talked about this in terms of the interaction. So I'm going to just answer that question for you guys right now. So 2 things that I want everybody to know about cancer specifically and cannabis is that, one, again, take this with a grain of salt, right? Because there are studies out there in animal models and cell petri dishes that support that cannabis can accelerate the growth of tumors and cellular turnover, and the same exact thing that it can reduce or inhibit the growth of cells, meaning inhibit the spread of cancer. What we know for sure is that there is no reason that anyone should be taking cannabis for an anti-cancer or an anti-tumor property, right? There is not science out there that supports that. Like, please do not go down the rabbit holes on Reddit or Google or any of those things that exist and say it, because it simply isn't backed by science. What we have seen in some studies is that for those that are on immunotherapy, there could be a potential interaction between cannabis and your immunotherapy, because, how I mentioned with CBD, there is an anti-inflammatory or property or potential. Just like when you're on immunotherapy, your doctors don't want to give you lots of steroids, or they caution you about taking high doses of ibuprofen or Advil. Same idea. It is very far from kind of a certainty in any way, but what I would tell you is, if you are on immunotherapy, that is one of the times where you should absolutely be having the conversation with your medical oncologist about this. And it probably has very much to do with, how much and when you're using it. Cannabis is only active in your system during the short time that it's either kind of inhaled or edible, which is like between 2 to 6 hours. And so a lot of this has to do with kind of the timing of how you're taking it. And then again, the specific question, there has been a lot out there, and Greg, I don't know if you wanted to comment. I'm sure in your work with a lot of breast cancer patients, kind of this question about the tamoxifen, and that has been sort of long-standing. I don't know if there's anything you wanted to
it comes up and up. I think that it becomes an individual decision. The comment, which is kind of very apropos, is kind of essentially, you're taking everything away that that can give me some mild intoxication like alcohol, and we really don't have any good evidence that it is interfering with tamoxifen.
No, we really don't at all. And frankly, kind of when you look, it has been done in animal models and kind of petri dish, bench top studies. And we've seen this, as I'm sure you guys have seen on the internet all over, right? We see this with so many things, right? So sugar, alcohol, chocolate. I've heard, almost everything you can see out there. We've seen some interplay, and no doubt there is, but whether this ever gets to the point of kind of affecting outcomes, we've never seen that. When they've looked at large scale population health studies with women that are on tamoxifen and using cannabis regularly versus those that aren't, over 5 to 10 years, we do not see any difference in effect of the tamoxifen in terms of kind of recurrence of cancer or progression of disease, anything like that. So I think that while, again, this is an individual kind of conversation I encourage everyone to have, there isn't sort of scary evidence out there, because I think the minute that we saw that, this would be a very different conversation. I actually think that what happens too often is that it gets blown up in social media or the news from sort of a one-time small case study type thing, because it feels sensational, right? We saw that happen in lots of ways hormone replacement therapy in women with cardiovascular disease. And now they're like reeling it all back and saying like, oops, we actually totally got that wrong scientifically.
Dr.
And
Worcester,
same question for all aromatase inhibitors too, guys. I don't want to say it's just tamoxifen. Same exact kind of clinical guidance I will give you from scientific data that is out there. Think of it the same exact way.
perfect. And one was just define regularly, how much is regularly?
Yeah, really good question. Again, we don't, it's not like we have a national kind of, definition of regularly. What we talk about and what like in our large kind of NCI funded studies, what we say that is determined as regular use is that it's twice a week.
Okay.
So if you want to sort of put yourself in some bucket, regular use is using cannabis at least twice a week. Again, I think a lot of this has to do with sort of how and when you're using it. And in reality, guys, cannabis is the most regularly used substance across the planet and has been for decades. We have very good sort of cancer databases and population health, studies that have looked at a possible association, right? That's not to say causation with either anti-cancer properties or sort of carcinogenic or pro-cancer properties. And we've never seen it, right? So I think there are going to be nuances to this, no doubt. But on those large scale studies, please don't think it's going to treat your cancer. And I would hope to help relieve you of a fear that it's going to worsen your cancer.
Mm-hmm.
This is a decision about sort of palliating the symptoms that are associated with the cancer or your treatment. That is where it can be a helpful space.
Great. One more, if you don't mind taking that. So CBD is known to be better for pain since it's an anti-inflammatory, one of our members was saying. Are you able to address that? Most people don't like it because they don't get high from it. Or they like it because they get high from it.
Absolutely. And here's what we know about, you are spot on. And here's what we know about CBD. And it's sort of anti-inflammatory and in that way kind of pain effects. CBG as well. I see someone just put CBG, not CBD. Yes, absolutely. CBG is a minor cannabinoid and it also has anti-inflammatory properties and is not psychoactive. The physiologic doses that are helpful anti-inflammatory, anti-pain dosing is so much higher than what you see in most, if not all, dispensary products because they are so heavily tilted towards the THC and kind of that kind of psychoactive effect for high. You see doses of like 5-10 milligrams. And in reality, where we've seen kind of, scientifically improved outcomes related to pain or anti-inflammatory effects, we're talking more like 50, 100 milligrams. And you can get those products and you can get them safely. That's where kind of that tie-in of like giving you guidance is necessary and not just the like, go try it.
There's also something to be said, since this is a plant and it has hundreds of compounds in it. And one of the reasons when Brooke was referring to the studies being done with Marinol, one of the reasons that people don't like Marinol is it is simply everything else is stripped away. So whatever benefits that you're getting from all of those other compounds, you're having just THC that's manufactured in a lab. And so there's something called the entourage effect, which is the idea that it is a combination of the variety of compounds in the plant that are providing some benefit. And so while there's labeling that something is high in CBG or CBN or some of these other cannabinoids, it's, truth be told, kind of full spectrum products with CBD that are not stripping things out, you're more likely going to get the opportunity to benefit from the combination and the synergies there that we have very little understanding of at this time.
So Greg, I do have to say that I thought she had a typo. I never heard of CBG.
Yeah.
And
Yes.
can you just define it one more time for us all? Because I don't think I'm the only one. Yeah.
You are not by any means the only person that is. So CBG is cannabigerol. And it is a minor cannabinoid that also has significant anti-inflammatory effects. The other thing we think that we see, and this is again sort of back to animal models and things like that, but that it can actually have an appetite stimulating effect. However, it's what we call non-psychotropic. There's been some studies that looked at it in animal models specifically related to kind of arthritis or rheumatoid arthritis and autoimmune disorders, where reducing levels of inflammation is helpful, and they've seen positive impacts there. And this is a little bit, and like, I love every time we do these conversations because there is a lot of nuance to all of the different minor cannabinoids, and a lot of it is like, we just don't know a ton about it, but, you know, people will get information from a variety of sources and then want to be able to find a product that is reliable that has that. And then it's a little bit like, now what, right? Where do we go? How do we kind of ask that? How do we get that guidance? And that's the disconnect that we struggled with a lot, right? It's like this silo where you're like, I heard this thing, or I got this, what do I do? And 99% of the time, your oncologist will be very well meaning and be like, I have no idea what that is. Because they don't. They can't. It's like asking the dispensary personnel about your tamoxifen. I hope they would say the same thing, right?
Great.
Let's go ahead.
So this is a little bit of that, like, kind of now what, right? So I think, you know, a lot of people say, oh, this information is helpful. And then like, what the heck do I do with it? So this is an opportunity to go to a platform that is kind of, you know, anchored in science and is able to give you some specific kind of personalized guidance for cannabis use. At Jefferson, we've started to use it with our patients. And I think it's sort of felt helpful for people to make this less mystifying and confusing. And then we get, as the clinician side of it, sort of a good, really good understanding of like, oh, I actually know what you had. Because I just had a conversation today with a patient and they said, I use gummies and they're helpful. And I've been falling, and he's got all kinds of things going on with his cancer and medically and stuff. And I said, well, what's in the gummies, right? Do you have any idea? No, someone gave them to me, right? So getting those specifics are helpful. And so this platform at EO gives you both educational resources. You can kind of just type in, here's the questions, and it gives you data with citations, you know, if you want to kind of go in a deeper dive, but also like ability to say the so what, right? Like where can I actually get a product that is going to be safe for me, and you know you're not kind of blindly walking in and getting sold, you know, you're not sure what you're getting.
Go ahead. And
Right,
so, yeah, no, I'm happy to. And so part of the process here is one would go online with a link that'll be provided, and you can profile, you see which symptoms you're looking to treat, you talk about you know, preferred forms, work schedule, sleep schedule, things like that, to kind of craft a care plan around that. And that gets translated into something that looks very prescriptive. It is essentially when you wake up this, at noon this, at 3 this, and it may be every time, it may be every other time, depending on what you're identifying, and it will provide a reminder to do that. Again, like trying to provide some structure around this. The other challenge is for folks who are going out and kind of buying CBD type products, which are now widely available kind of everywhere, as well as something called Delta 9 THC, which is really kind of an artificial distinction. In a way to get around some of the hemp legislation, manufacturers have figured out how to legally extract a fair amount of THC from federally legal hemp, meaning that you can get some products out out of dispensaries that have a decent amount of THC in them, and it's a very unregulated market. And so good producers, EO of which is one, are subjecting themselves to outside labs and certifications that are assuring good manufacturing processes, and that what is said to be in something is actually in it. The same with any kind of supplement or vitamin or other products that are kind of less regulated.
Because there's a whole lot that I have seen our patients get into that is not safe. And that's one of the biggest things that I think is important, right? Is that we really want to kind of create a space where you can get safe access and some guidance in it. And just to give you kind of a quick and dirty overview of, like, we talk about the different forms, right, that people can use cannabis in. It's all over the board. The buckets that I'm going to tell you to think about it in is something you inhale, something you ingest, or something you rub on your skin, right? Those are the three big buckets. I am going to tell you, I will always have to put on my doctor hat and say that, like, I don't want you lighting anything on fire and inhaling it into your lungs. It's just not good for you. That being said, the majority of people that use cannabis smoke it. That can be a joint or a blunt or a bong or all kinds of different things, right? Or vaporize it, which is not something lit on fire. It's heated and you're actually inhaling the vapor of it. That's like the nicotine vapes that you see people doing all over the place, right? Similar to that. A whole world of concentrates and dab rigs and all this stuff that we don't need to get into unless someone really wants to. The ingestible products are things like gummies or edibles or liquids, tinctures that you put under your tongue or swallow. And then the topical is a topical, right? The biggest differences are how long does it take for you to feel it and how long does it last in your body? Anything inhaled is fast. You feel it in 5 to 10 minutes and it lasts much shorter, 2 to 3 hours. Anything ingested takes longer, right? Somewhere between 20 and 60 minutes, depending on the form, and lasts longer, 4 to 6 hours. Like, there's the quick and dirty of the way to think about what products you can get access to.
That's
Excellent.
great. Thank you. Yeah, it was one of the questions. And then the other one was just talking about, can it be used in combination if you have severe pain? So, is it safe or advisable to combine with pain meds like ibuprofen or Tylenol?
Very good question. And yes, it is. In that way, that is a nice thing, right? We don't see that there is any detrimental effect to your kidneys or your liver or sort of an additive effect with other pain medications. So in that way, it is a safe combination product. We talk to our patients about this a lot. And because you have that very distinct thing called your endocannabinoid system, it works through a different mechanism than, say, an ibuprofen or an acetaminophen or oxycodone works. And so what we know about effective pain management is that what we call multimodal is the most effective, meaning if I can attack it through different receptor systems in your bodies in different ways, it is more effective than just pushing a higher dose of one thing alone.
Great.
Should we stop the share and?
Yeah, I think that's great.
Yeah.
Now, I know we were going to pop your link in the chat just to go to the website. Is there a certain link that you wanted the Unite for Her community to have if they wanted to sign up for a clinical care plan?
Yes, we will share that. I'm sorry, go ahead, Camilla. We will share that with you. And certainly go online and play around with it. It has really been interesting. We've probably enrolled, I don't know, 70 or 80 patients to date. And it's been a bit of a game changer for folks who either wanted to refine what they were doing, what they were taking, and for others who may have tried it at one point and just it didn't kind of provide what they were looking for, but that's certainly not a definitive answer. This is a way to reapproach kind of cannabinoid-based care and seeing if with a little bit more guidance and a little more specificity in the recommendations, if it might be more helpful this time. It will also, the platform will point you to if higher THC products are part of what are recommended, it'll point to a localized dispensary that is near you if you live in a state with recreational or medical dispensaries. There are a couple of online stores as well from which products can be ordered to that are able to be mailed and delivered. So.
And guys, one thing that, I think is very specific to all of you going through your cancer treatment that really mucks up your hormones and potentially throws you right into hardcore menopause is that your sleep, it's like kind of, falling off a fast moving train and the sleep is just a mess, right? And that's like the foundational part when I talk to my patients about like, we got to get you good sleep, right? Because the rest of the stuff crumbles if you're not sleeping. And there is evidence about cannabis and sleep, and we don't have a ton of great medications for sleep at times, especially for longer term use, or that don't leave you feel kind of like groggy or hungover in the morning. Like a lot of my patients that try trazodone or Ambien or other things, there's stuff that gets troubling with that. And so it is one of the spaces where, I'm intrigued about kind of, further research and we are getting into more research there for that. But, with all of our breast cancer patients, I feel like sleep, just like sex, we don't talk enough about, but like sleep is one of those things that it matters. So, and it gets mucked up in your hormonal kind of, deprivation therapies.
Brooke,
And Dr. Worcester,
Oh,
I just wanted to comment. We had a question a little bit earlier. I'm glad you mentioned sleep. And I think this question comes from sort of the use regularly. We had a question about the Indicta tincture every night for sleep. Is that too much? So I can see where there could be concern if I'm using it for sleep every night. Is that too much? Is that an appropriate frequency?
So indica tincture by and large is not a bad thing, right? That's just remember, that's cannabis indica is the genus and species name of one of the plants. What I'd love to know is like, what's the composition of it, right? What actual milligrams of THC and CBD are you using? And then how effective is it? Using it every night is not too much. Some people like that. What I can tell you for sure is that people do develop tolerance to the THC component very specifically, right? And that kind of psychoactive effect. And so sometimes regular use means people have to up their doses. One of the guided ways that we get around that in the same way that I sort of tell my patients, we need to opioid rotate you, meaning have your body see a different pain medicine because your receptors won't view it exactly the same, is we do the same thing with cannabis, right? You sort of rotate someone, and then that can allow you to kind of reduce the amount of THC, and your body is still seeing it as fresh. So there can be kind of tolerance that develops, but it's not necessarily like it's too much, nuanced based on kind of what milligrams are in it there and what you're using.
We're also, and if somebody has been taking like a benzodiazepine, like Ativan or Klonopin or Xanax, or some of these other kind of, very controlled substances that we know are fine for occasional use, but can be problematic when people are taking them habitually. We've seen a lot of people for whom this has been when we see patients at the 1 year to recertify them, sleep, anxiety relief, nausea, pain are always at the top of the list of whether that's why they started or not. Those are always kind of high on the list. Brooke, there's a question here about Delta 8. THC. Somebody is taking that for sleep and is taking a Delta 8 gummy with melatonin.
So Delta 8 is like the little sister of Delta 9. It is sort of structurally very similar. There's a carbon that is kind of one space different. If we want to, get into the geeky chemistry part with me, I'm happy to do that. But it is less psychoactive milligram per milligram than THC. Like that's the big difference. Hence, the fact that the federal government didn't sort of draw the line in the sand for Delta 8, they did it for Delta 9. And so when the Farm Bill allowed this proliferation of these hemp-based products, what the for-profit businesses saw was an opportunity to say, I can make these products that have psychoactive components in them and sort of extract this and then artificially insert more Delta 8 than would normally be there because it'll get people more high, quote unquote, right? There's nothing bad about it. It is less psychoactive. I think it matters more that you're getting the products from a place that have those good manufacturing processes and are NSF certified, things like that. That otherwise it's fine to use. There's nothing inherently bad about that by any means.
So another really good question here from Liz. I've heard that CBD can reduce the effect of THC. Is that true?
So this is what a little bit to what Greg was talking about that entourage effect. And it's what it does in we think, and in sort of some studies that have looked at this. And now take this with a grain of salt, guys. This is usually in like young, healthy volunteers in a one-time study. But what they've seen is that when you have products that are not just unopposed THC, but rather have those other cannabinoids, CBG, CBD, the other things like that, people get less of the high, quote unquote, right? So less impairment in coordination, in response time, in memory, in sleepiness, if you know that. So that's why it sort of people will sort of say, generically it lessens the effect. In a good way, it often makes that THC more tolerable to people that don't want to feel as high or loopy or anything like that, because there are things that THC does that's good. Let's remember, right? It goes into your brain and targets this lovely kind of named center called your vomit center, which does exactly what it tells you it does. And so THC reduces the activity in that space and therefore prevents vomiting. It also sort of stimulates appetite centrally. And so it's not that any of these things are all bad, right? It's actually figuring out what the combination of them together that is going to be best for you is. And I also want to be very clear, just like I would say to all of my patients about anything, sometimes this just isn't going to be right for you. And getting the answer that actually I tried a right, safe product, and it was the thing that I thought was going to help and it didn't, and I didn't have to spend hundreds of dollars or have horrible side effects, that's helpful too, right? It's the same way that I guide people to the right antidepressant. I don't just say, pick one off the shelf and take as many pills as you want. This is the same thing. And some of it's going to be not a right fit for someone. And that's okay. You have that knowledge then in a way that you can feel confident about too.
One more comment about telling your anesthesia team about cannabis use. So there is some evidence that in cannabis use does require more anesthesia. I see all these anesthesiologists on TikTok who say, these are the things I want to know. I don't care if you use cannabis, you just need to tell me.
Yeah. Please, the number one thing that I was proud of ASCO for sort of saying in these guidelines is like, how do we foster an open, non-judgmental conversation about it? And it can't just come from our patients, because thankfully, guys, you're the ones that have pushed for states to legalize cannabis. It wasn't the American Medical Association. It wasn't ASCO, right? We're lagging way behind. So it's pushing the doctors to get in the conversation and say, I'm not upset. Just we want to be able to talk about this. And so hopefully we will really move the marker there.
Right. There was one that they just wanted you to verify that if you could tell the people in Pennsylvania that THC is legal, and that they can get it without a medical card.
In Pennsylvania, you cannot get state-regulated dispensary THC products without a medical card. You can get THC products that are available through these other sources that we said are hemp-based. Any of you can get them, even if you live in Idaho, where all products are not available. So that you said THCA, that's the hemp-based part, guys. That's all of this has to do with that line in the sand of where it's coming from federally. And I suspect all of this will change rapidly over time as we reschedule this. So, hang in there, that'll change. But yes, you can get access to these things.
Great. THCA, see, there I am again. That's how much I don't know. That's how much I don't know.
Yeah.
But it's so good. And I'm so glad you're making the conversations just a normal conversation in the medical field. Obviously, ASCO is putting it out there. We're going to be going to ASCO at the end of the month. So it's just really important to see all that. And I know that I ended up going on your website to try the whole entire Q&A, the intake form. I took myself back 20 years ago when I was sick. How did it feel? What did I look for? And it was so thorough and just gave me just a confidence of guidance, because I do feel like we educate and then set them free, and they don't really have the access or the knowledge to take the next step. And this is that bridge that I feel like we have been waiting for a long time, to have a clinical care plan by physicians at a hospital network that is not afraid to talk about cannabis and give us the facts. So I thank you for that.
Couple more just quick questions. Is there something specific to look for at a dispensary, such as a certification? They're everywhere in New Jersey.
So, yeah, any dispensary that is state licensed has to have all of their products be tested externally at, qualified laboratories, right? It gets murky because you'll see hemp shops, smoke shops, things like that, where you can walk in, right? The biggest sort of thing to ask is if this is a state licensed dispensary or not. And if they're talking about products that are hemp products or other things like that, then they're not. And you can look or ask for labeling on the products themselves to see what kind of quality assurance and testing there is. And if you're not seeing any of that, or it's kind of, doesn't have any of those qualifications that we talked about, I would steer you away, because there are icky things that get kind of adulterated into those products. Then there's no regulations around them.
And unfortunately, at this time, none of this is covered by insurance companies. There is hope that will change over time. But at this time, it's a federally illegal substance. Insurance companies are really not compelled to cover it at all. I think that, when we do our homework and and there's more research evolves, and when the legislation changes, when it's rescheduled, there will be different discussions about that. So stay tuned.
Thank you guys so much.
Thank
Happy
you.
to certainly kind of follow up and always there as a resource for people, for you guys about this. We love Unite for her and everything that you've done for the patients, and kind of creating the dialogue around this and other things. And I see it from all the great stuff that you do for our Sidney Kimmel patients. So thank you.
Thank you so much.
You're welcome.
And please feel free. Our email is, if you
Correct.
Yeah.
Yeah,
You send us an email.
it's right there. Yep, the email is there, actually, ufh@eo.care. That allows them to know that it came from our community. Go around, get on the website, check things out. The care plan is free for the Unite for Our Community, so know that there's no charge for that care plan. And then we always want to hear, how you like it. I mean, we want that feedback for sure. So make sure you give us the feedback on what you experience, because we want to continue to keep the conversation going and give you the best guidance possible. Brooke and Greg, thank you. It was awesome.
Thanks, guys.
Thank you
Have a
so
good
much
night,
for
everybody.
having us. Have a great
Bye.
night.
Thank you.